Hi, and welcome to this program titled Who is the Clinical Nurse Specialist, geared towards giving information about this role to students of all levels, to nurses who are thinking about graduate studies, and healthcare leaders who are thinking about employing clinical nurse specialists and what the benefits of clinical nurse specialists would be in their organization. So I've been a professor and coordinator of our adult gerontology clinical nurse specialist program since 2007, so a long time, and we've been online since then, so not just because of COVID. And we do online really, really well, and we keep our class sizes small, so we get to know our students very well, and we have 100% pass rates on our national certification examinations. We have an all-time pass rate on the critical care clinical nurse specialist exams. So we do, we have students who come out of the program who are practice ready and they pass their exams. So whenever we start with anything, right, we want to know the history. So we kind of say from the clinical nurse specialist world, Florence Nightingale was really the first clinical nurse specialist, because once you understand the role a little bit, you'll understand that outcomes and data really drive what a clinical nurse specialist does. We are always thinking about outcomes and the best results, nurse-sensitive indicators, nurse-sensitive outcomes. So, and Florence Nightingale collected data, right? She used that data to drive decisions, and that's exactly what a clinical nurse specialist does. But really, the foundress of clinical nurse specialists was Hildegard Peplau in the 1950s, and it began with psychiatric mental health clinical nurse specialists because she felt the foundation of the patient relationship was all about relationship-based care and therapeutic communication and relationships. So it's that we have still retained that as the primary and number one competency of the CNS role right now is relationship building. So Hildegard Peplau was the foundress. Then there was, through time, an initiative to merge both the nurse practitioner roles and the clinical nurse specialist roles together. But we clearly saw where there was a need for a nurse practitioner filling the gaps in primary care, and the clinical nurse specialist who was not only a practitioner, but was also providing nurses with support and really working with the organization and seeing the bigger picture every time they saw a patient as to what's going on in the system, what system level changes need to occur, because the CNS's patient is the patient, the nurse, and the system. So we think more broadly. So the National Association of Clinical Nurse Specialists was formed, and that was really to protect the role. And we're still in existence. I'm on the board of directors for the AG-CNS, and we have over 80,000 clinical nurse specialists in the country. The other big emphasis for clinical nurse specialists are whenever events emerged. That was a huge impact on the need for clinical nurse specialists to really monitor processes and then outcomes. And when we started not getting reimbursed for certain readmissions and certain events, it became very, very important that we need another set of eyes on what's going on, and we need someone who can develop protocols, procedures, policies, and bring best practice to the bedside to prevent these never events. And then, of course, COVID-19, I mean, nursing support more than ever, particularly in our new graduate nurses who will be coming out of programs that were ran a little differently in the last year, right? A lot of online, face-to-face programs that went online, a lot of simulation. So we know that nurses are going to need more support. So that's just more of a current need for the clinical nurse specialist to provide that support for nurses, not just during the pandemic, but following post-pandemic. So in this slide, I mentioned earlier the three spheres of CNS impact. So there are three: patient, nurses, nursing practice, and the system. So as a patient, we have prescriptive authority. We can function as a practitioner. A lot of clinical nurse specialists like to also educate and mentor They function as consultants to see patients that are complex, vulnerable, have more extensive needs, and need more time. They're an advocate for the patient when there's ethical issues, crucial conversations, changes in care, and the coordinator, those difficult patients you need to get home, but if things are not coordinated well, we know that patient can fall through the cracks. And then there's the nursing practice element, right? So it's educating the nurses, mentoring the nurses, advocating for the nurses, bringing evidence-based practice to the bedside, and crafting the 3 Ps: procedures, protocols, and policies that many nurses work off of, right? And revising those and making sure that nurses have all the tools they need to provide the best possible care to their patients. And then our next patient is the system itself. So we function as a leader, we are a detective, we are a fact finder, we are a data manager, and we make change happen. Clinical nurse specialists know all about change theory, and they understand it very well. And they are the person that you want when you need to roll out a new initiative across the system and be able to monitor it over time and work directly with the nurses in the implementation of a new initiative. So those are the 3 patients of the CNS, the 3 spheres. So the role of the clinical nurse specialist, the versatility of the role is probably the most powerful piece of this role. So we function as a practitioner. We have advanced pathophysiology, advanced pharmacology, advanced physical assessment skills, and 500 clinical hours of working with patients. So we can function as a practitioner with any specialty population. We function as an educator. So I give you a few different pictures to give you ideas. If you want to go into academics, a clinical nurse specialist graduate degree would be an awesome one because you get all the principles of adult education and you work with nurses. Now, the other picture you see in the middle is on rounds. I think that is where a clinical nurse specialist makes an enormous impact. When they are actually in rounds and they are seeing the bigger picture and identifying consults, palliative care, home care, different needs of the patient that maybe are being overlooked. So there's that extra set of eyes that are in there with clinical expertise. Researcher, so that is what I do. I spend a majority of my role in academics doing research. So that's the kind of the picture up on the right. So with some of the data charts behind that person. The fishbone diagram, a leader. So you have to dissect these problems, figure out where the weaknesses are, and do a thorough systems assessment in order to move forward with intervention. So the fishbone diagram kind of highlights that. The young lady sitting at the computer, I mean, you got to look at data, right? Data drives decision making. So the clinical nurse specialist is well versed on collecting data, analyzing data, telling stories through data, and knowing what needs her or his attention. And then administrative roles. You learn a lot in a clinical nurse specialist program about team building, conflict management, how to manage groups of people. So administrative roles and budgets and things of that sort are also within the realm of the clinical nurse specialist. So versatility, definitely. The clinical nurse specialist thinking, and this is how they think. So when I talk about advocating for the nurses and thinking about the nurses, I mean, the clinical nurse specialist is the nurse's APRN. This is my beautiful dog, Ava, and Ava is a Doberman. You can see those big ears on Ava. So when I thought of this statement made by a clinical nurse specialist in a study of mine back in 2015 when I did a qualitative study of 12 clinical nurse specialists across the country, I will never forget this statement. When we sit at the table and hear a new initiative coming forward, she means the clinical nurse specialists, are all thinking, how will this affect the practice of our nurses? So isn't that wonderful? You are an advocate for full scope of practice for the nurses. And so I just want you to remember that statement because the clinical nurse specialist is unique in that way as an advanced practice nurse, that we are thinking about the practice of nurses. So no matter what, it's all about results and outcomes. So the important for the clinical nurse specialist is to meet with leadership and you align your work activities with the organization's goals. It works well because we have advanced clinical skills and disease management skills so that if there are gaps and weaknesses in certain areas that need to be filled, a clinical nurse specialist can prescribe. So, you know, for patients who maybe need even non-pharmacologic needs like, you know, more supportive cares, nutritional support, things of that nature. We have the 3 spheres of impact. So we're always thinking about when we see a patient, what's going on at the systems level? Are there issues at the systems level that I'm seeing in this one patient? We also focus on illness management, so symptoms, quality of life, the patient experience, all very important outcomes. We think about missed nursing cares, you know, the ratios of nurse to patient now and what's getting missed, even things like oral care, you know, things that are really, really important. So you have, you know, clinical nurse specialists thinking about all the missed nursing cares. The nurses APRN is what the clinical nurse specialist is, offering nursing support on best practices, but being there for the nurse. And again, just outcomes focus, always thinking about cost containment, the patient experience, provider satisfaction, the nurses, the physicians. So all of those things are important to the clinical nurse specialist. So indirectly, the clinical nurse specialist affects nursing practice well, directly affects nursing practice, indirectly affects patient care, right, through the nurses. So clinical nurse specialists are often consulted informally by nurses, all right, regarding nursing problems. New patient or something with a patient they're not familiar with, they ask the specialist. Nurse residency evidence-based practice mentors are programs that clinical nurse specialists may champion, which leads to a reduced percent of turnover rates, an important outcome. They provide expertise to nurses caring for patients at the bedside, which I kind of mentioned in the consult, and just offering a lot of support to nurses on what they need. We know through the COVID, the pandemic, and now a return to normalcy, nurses are going to continue to need lots of support. The other indirect care role of the CNS is leadership, meeting organizational needs through projects. So the students in the program, outside of seeing patients and working with the nurses, learn how to execute projects and lead in important projects that deal with fall reduction, hospital-acquired pressure injuries, CLABSI, CODI, civility programs, sepsis pathways, all the bundles. A lot of clinical nurse specialists are behind magnet status. They lead readmission prevention bundles. They lead in selecting best products and technology. So students focus on like using failure modes and effects analysis in order to proactively identify where something could go wrong. So a lot of indirect care role skills that the clinical nurse specialist brings. Again, just speaking to the versatility of this role. So from my study, when I analyzed what do clinical nurse specialists really do, these were the things they told me. They identify, assess, diagnose, and manage the high-risk patients. So I remember one CNS telling me, when I come in the morning, I'm triggered on which patients are high risk for falls, aspiration precautions, things like that. So those are the patients I'm going to go see and just monitor as the day unfolds. They work on projects, kind of how I mentioned, maybe fall prevention, CODI. They write policies and procedures, so they are your person who can analyze the data, update these policies, procedures, protocols, so that they can be used by the nurses out on the units. They analyze data. That's critical. Data every day and of all the major initiatives that's going on, again, to drive decisions. They go on patient rounds. They work with the nurses. They troubleshoot. They attend meetings. They are there on behalf of nursing practice and they often meet with the nurse leaders. Very, very important, as I said earlier, to align what they do with the organization's goals. They investigate errors, host debriefings with the staff on what went wrong. Just lots of movement between patient, nursing, and organization work throughout the day. Again, speaking to the versatility of this role, going where needed, filling in the gaps. As a practitioner, we have prescriptive authority in most states. And we do, and so some clinical nurse specialists choose independent practices, filling gaps in cares, maybe a weekend palliative care service, heart failure patients. So, going into those specialty areas, diabetes, and working in collaborative relationships with physicians. So we are certified nationally. We get licensed by the state. We have a national provider identification number, and then we are free to go through the credentialing process. And there are 500 clinical hours in the clinical nurse specialist program supporting, with supportive evidence to go through a credentialing process. Data supports the need for all CNSs to have a prescribing role. So a lot of CNSs haven't chosen that role, but as more states allow prescriptive authority for clinical nurse specialists, that role is quickly changing. So this is an example of how a clinical nurse specialist consult would unfold. So say you have an 80-year-old male, change in blood pressure, heart rate, mental status. The nurse consults the clinical nurse specialist to see the patient. Okay, so you have some rapid changes in a patient. The clinical nurse specialist does a focus assessment, gathers additional data like a pulse ox, a blood sugar, and diagnoses possible sepsis. Central line has been in place for 6 days. So the clinical nurse specialist would initiate an IV fluid bolus and one-on-one RN patient monitoring while she or he would contact his supervising physician who then would take over with the orders and instruct, maybe to initiate broad-spectrum antibiotics or, something intensive for this patient that is going down quite rapidly, and getting the patient probably to the ICU. So the CNS would follow through on this patient, get the patient to the ICU within a timely fashion, within 30 minutes, with the CNS giving the handoff to the ICU intensivist. So this is just one example of how a clinical nurse specialist would be useful. When they're covering so many units, usually a couple units within a facility, being able to do this kind of work and respond quickly when you don't have physicians right there on hand. They fill gaps in care. Clinical nurse specialist monitors Foley catheters, assesses for removal day 1 to 2 post-op. So they're kind of that person monitoring these things. High risk for falls, aspiration, implementing fall and aspiration precautions independently. Engaging nurses in pressure injury precautions on most every patient, right? Every patient's at risk. Supporting new and seasoned nurses, who can experience burnout, compassion fatigue, and general threats to their wellness due to the stresses of the job. So they're there for the nurses, implementing programs if necessary to help with retention and satisfaction of the nursing staff. This is a great elevator speech by one of my students right now, Judy Waltz, out on the East Coast, and all the students write elevator speeches, but this was one of my favorites, so this one I chose for this presentation. The clinical nurse specialist is an advanced practice registered nurse with prescriptive authority who practices holistic, comprehensive, advanced nursing care for complex patients, improves nurse-sensitive indicators by implementing evidence-based practices in a cost-saving manner, and leads change at the system level. I feel that definition hopefully sums up everything I've mentioned in my presentation today. So, I believe every patient and every nurse deserve a clinical nurse specialist, and I am more than happy to talk to you more about this role from whatever angle you're coming from. That is my cell phone number. You can call me, you can email me, you can message me in LinkedIn, and please visit our website to learn more about the CNS role and our program.